5 o'clock. It's 5 o'clock, so we are going to be starting. We'll focus on joint health. In most of my classes, especially in the chair yoga, I do a little bit of therapeutic work. My name is Sanmay Mukhopadhyay. I have a few degrees in yoga therapy and yoga philosophy and all that. Professionally, I'm a techie, but I just retired from work to do full-time yoga. I have a YouTube site, I have an app. You can take a look at my therapeutic app called Dr. Yogi. So today we'll focus on joint health. But yoga is holistically reductionist. So what that means is we focus on a disease or a few diseases, but then that has to be also spread out as a holistic mechanism. Otherwise, it doesn't work. It doesn't work in isolation. So A asana for back pain and A asana for headache, or one pranayama for this or one mudra for that, it never works. So if you ask people that, bear in mind it doesn't work. It has to work with a sequence, with a holistic framework. And people who claim that works are either lucky or they're not making any sense. So with that, we'll start our session. It's a 45-minute session, and I'm going to end that exactly at 5:45, because they start a meditation at 6, and I don't want to get into that. It creates a lot of issues. So we'll be mindful of the time. Inhale and exhale. So as you exhale, let the exhalation flow out smoothly. It's not just inhale, exhale. No, inhale and exhale. Exhalation is always longer than inhalation. And then as you put your palm together, put a little bit of pressure there. We want to make it a very therapeutic session. As you put pressure here, you're engaging your mind, you're engaging your peripheral nerves, you're engaging your tendons, your small bones of the fingers, palms and wrist. So it's all designed. Namaskar mudra is a very powerful mudra. Okay, so engaged. We'll chant a round of Om. You can do Om or you can do Auma. I like Auma. Inhale. And now we'll do the actual prayer. Oh, 1 second, I've forgotten one thing. My apologies. So, Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu ma vidvishabhai. Om Shanti Shanti Shanti. Grab your right wrist from the left palm. Inhale and exhale all the way to the ground or in front of you. to your Ishtadev or Devi, or to any higher power you believe in. So we will start doing a few simple postures. Let me just put my too many gadgets around me. Okay, so let's put our palms in the front. Inhale and exhale. Inhale fully and exhale every bit of oxygen out. Slow, continuous motion till you touch your palms. Last one, I'll do the count. Inhale, 1, 2, 3, 4, 5, 6, 7, 8. Hold a bit. Exhale, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and relax. Exhalation is always longer than inhalation. Exhalation triggers the parasympathetic nerves, and the longer you give, your parasympathetic tone is more than your sympathetic tone, and therefore your body goes into a calmer state. That's the physiology behind why you exhale more longer than inhalation. Exhale and inhale. Exhale. So when you exhale, try to touch your biceps to the ear, but don't go like this, go like this. Exhale. 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 And exhale. Your two sides of your body and the pan spinal muscles are getting played with, and that's by design. Exhale and exhale. Exhale and exhale. Last one. Exhale and hold it. If you have the handle of the chair, hold it and exhale and hold your breath a bit. Spinal cord straight, neck aligned, and release and go to the other side. Fantastic. Come back. Shoulders. So as we do shoulders, now we talked about joint health, so we'll start from the top, go slowly to the bottom. So put your palms on your joint of your shoulders, and then inhaling, exhale. Inhale, try to touch the two elbows. If you cannot, that's fine. Inhale and exhale. The other way around. Inhale and exhale. Inhale and exhale. Inhale and exhale. Okay? Now we'll do another shoulder, which is even more, has a massaging effect. Now I think I have talked about in previous classes massaging. One of you I think have a microphone on. Please mute yourself. I think, let me see, Ramani Iyer, I think I'm going to mute you all again. Yeah, let me mute you. Yeah. So what's happening is as you are making those motions over here, these muscles are getting stretched. There's a layer called fascia below your the outside layer, epithelial kind of, and then those signaling lets the muscles relax a bit more. And therefore, that's why we do asanas first, and then we gradually go into pranayama, where we can inhale and exhale even better. Okay? Method to the madness. So we'll do shoulders, inhale, exhale. So back to front, bottom to up. Inhale and then exhale going down. Inhale, other way around. And you can sit, when you sit on the chair, sit a little bit to the front because you need some space for moving back a bit. And you also need to keep your spinal cord straight. Don't sit on a sofa or a soft place. Sit on a hard chair or a chair with a very firm cushion in there. So inhale. Fantastic. Now we'll do our neck. So we have been doing this. Okay, before I do the neck, let's do a mild slow bhastrika. Inhale and exhale. So active inhale, active exhale, but slow. Inhale, 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 inhale. This bhastrika is a very effective tool to relax your shoulder joints. In fact, it sends ripples down to your hip joint, to your knee joint, and to your ankles. And ankles are very important. This and ankle, they are the two holders. This bears all the center of gravity, and this is a very complex maneuvering joint, hinge and socket joint, highly complex, goes almost 360 degrees, and that needs to be maintained properly. And when we do the bhastrika, that allows not only physically, muscularly, but through nervous stimulation, allows all these other joints to get stimulated. Okay? Just keep those things in mind. These are all connected, and there is a huge amount of physiology behind it. People will say, well, what is yoga? We don't know whether there is any scientific proof. But there's a lot of science coming out. Not everything is proven, but a lot of science coming out. And there's 7,000 years of traditional knowledge, which is equally important. Okay? Now we'll do the neck. So we'll do side, side, exhale, 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 and exhale, exhale, and exhale, exhale, and exhale, and stop. Now we'll do head up and down. So when we do head up, again, spinal cord has to be straight, and the head goes as far as you can. Don't go like too much. Inhale and exhale, chin to chest. Inhale and exhale. Inhale and exhale, chin to chest. Chin to chest is important because it triggers the larynx over here, and this complex nervous system here, the post and pre laryngeal systems that triggers brain into the brain, waves into the brain. So chin to chest is very, very important. We'll do this. Exhale and exhale. Softly, using your palm to softly allow yourself to softly put it down. And let it go. We'll do a roundabout with the head rotation. So your head is going either clockwise or anti-clockwise, 3 rounds each direction. Inhale. Okay, so we are done with neck. We are done with, well, done meaning for today's. There are a whole bunch of other things there. We'll introduce this as in the next classes. Shoulder we have kind of done. We've done a little bit of elbow. So let's do our fingers and wrist. Okay, so you know this. You probably have done with other teachers. Then put your thumb inside, press it, Adi Mudra, and then up and down. Inhale up, exhale, inhale up, and then round about. And relax. Push the wall. Like a tiger claw. So push it out, inhaling, out, and relax. Last one, inhale, and relax. Very good. Okay, you feel the relaxation? You don't have to say yes or no, but I'm presuming silence is yes. Okay, so the other next one we'll do another one, which, observe me, you're holding your palms from the back, the fingers. You do inhale and inhale. Inhale, exhale, inhale. Exhale, inhale. Relax. Okay, so do a little bit of on your head, on your cheeks, on your neck softly. Very powerful tool. If you have arthritis in your fingers, this is like a magic to mitigate it. Don't go away. It will reduce it. So elbow and wrist. Extend it out. Roll it. Other way around. And relax. If you have frozen shoulders or some kind of tendonitis or even other serious ones, all these can help you. One is it can help you not to get into surgery, or if you get into a surgery, help you to rejuvenate and recover from it. So the other one, which is very good for general shoulder issues, inhale you and exhale tightly, very tightly, using your latiss and deltoids here. So come here in the front, palm on top palm. Inhale, parallel to the ground, and go take the inhalation all the way for a U, and then exhale a W. But use these muscles on the side, the back side, the deltoids, the lattice here. Inhale. Looks like a W. Okay, I think we are done with the upper extremities and palm and hand and all these. Now we'll work on the shoulder, waist region a bit. So bring your palms, Adi Mudra, on the top of your upper extremities. This is called upper extremity. Exhale, 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 exhale. Not too much. Don't go too deep. Just shallow. We don't want to overstrain. Again, another rule of yoga is you don't go overboard. No pain. Little bit of discomfort, little bit of extra stretch, a little bit of, what I call a fashionably discomforting stage. That's okay. Because when you go into a discomforting state or a painful state, you are activating your flight or fight syndrome, which is your sympathetic tone, which means you ultimately, if it goes too long, ultimately secrete bad hormones like the cortisol, which is like a steroid. So you don't want to go into a very stressful, exciting state. That's not good because of the secretion of those negative hormones. Then, so that's why you want to do a little bit, but then stop right there, and then go into this calming state of simulation. So inhale and then exhale. So you are actually going into a calmer state, which means you are releasing your good hormones, serotonin, dopamine, happy hormones. You feel good, you feel relaxed. Exhale. So this is mindful yoga. This is you know what you are doing. If you don't know what you are doing, then yoga becomes a stretching. As a lot of people say, "Oh, I want to do a yoga stretch." There's nothing like a yoga stretch. Yoga is much larger than a stretch. And inhale and relax. That takes care of your, basically you've done the C's in the back. Now your L muscle, L vertebrae are getting invigorated. Your rib cages are getting invigorated. There are a lot of joints in there, a lot of tendons, a lot of connections, connectivities, and we are invigorating those. Let me see the time a bit. So 26. So we have just 20 more minutes. So we'll do 10 minutes of these practices, and then we will do 10 minutes of pranayama and maybe a minute of meditation. And by the way, I do take meditation in the evenings. Tomorrow I have a meditation class which will talk about, I've been talking about different types of meditation, and not tomorrow, on Friday. And I'll be talking about Vipassana technique. So if you want to join, same Zoom call, but 6 o'clock Friday. And then Saturday morning, 5:30, I have also a meditation and pranayama class for half hour. Okay, so now let us go to the bottom. Let's put your leg up. And let's do a little mild up and down. So this is again a mild up and down, inhale, exhale, to basically start stimulating and relaxing your hip joints and the whole mid portion, and your knees and your ankle. So now what we'll do, we'll hold our toes and do a little massage. So it's not only massaging your foot, but it's also massaging your palms. Okay, it's a full body thing, as you will see. Now move around your ankles. As I said, ankles are very, very important. The whole CG eventually goes through your ankles. If your ankles are gone, it's trouble. So we want to see each joint is connected with the other. In fact, in therapy, when we try to do something, mitigate a pain in one joint, we often go a joint or two away to fix that joint, and that has triggers on the joints at the back. So now up and down, you have a free format here, and then you do a little bit of hammering. So now this is good for the peripheral nerves. A lot of people have neuropathy, peripheral neuropathy, these, and then like doing like this, doing like this, doing like this. These are important techniques to mitigate those issues. Okay, so now do a little bit of vibration on your thighs and knee. Spinal cord is straight, so if your spinal cord goes down, bring it back up again. You don't want to position your spinal cord like this, bent like this or this. You will start getting pain somewhere, and you will blame yoga for that. So it's very important, no matter what posture we do, we situate our spinal cord straight. And we should be aware of that. It will not be perfect all the time, but we should always come back to it. Okay? So then like this. So push a little, exhale, 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 exhale. And now just the reverse breathing, exhaling, hold this and hold the toe here and bring the knee to your chest, exhaling. And then go normal breathing, hold it, and then hold the whole leg, bring it as close as possible. Spinal cord straight, adjust yourself, feel the feel the pressure on your hip joint, hip sockets, on your gluteus maximus. Okay, it's good for your digestion also. And then let it go. And then slowly, very slowly, well, we'll do a little more fun. We'll hold this and hold it and do a little rock the baby. It has a Sanskrit name I'm forgetting. I'll let you know next time. And bring it down. Fantastic. Let it slowly bring it down. Okay, we'll do a little bit of meditative technique after this, just a little bit to relax your whole body. And bring this one up. Hold the toe. Massage it a bit. Roundabout, up and down. Then ankle. Okay, then do a little bit of this is like a half butterfly, and a lot of you may have done this before. Half butterfly, very nice. So when you are doing this butterfly, you are exhaling down, because these are very quick motions. And then when you bring it up, you're squeezing your stomach, so you are exhaling up, and then you hold your ankle, exhaling, chest coming close to the knee, exhaling, totally take everything out. Put a little pressure on the stomach, and now normally breathe. And feel the stretch and strain. Feel that pull in your hip joint. Eyes closed, smile on the face. And then let it go for a few breaths. And then we take this. I remember the name Shishupala Asana. This is called Shishupala Asana. So we'll do this. Feel that pull on your shoulders, but try to keep your spinal cord straight. That's the trick. Spinal cord straight, and then do the Shishupala Asana. Exhaling out. Ideally, the two palms will be clasping each other. I can do it much better when I am on the ground than on the chair, and we'll do it another day. And relax. Just go through a scan through your head, face, eyes, nose, mouth, chin, chest, tummy, upper back, lower back, the whole groin area, thighs, knees, calf muscles, ankles, feet. Feel that free flow of energy slowly bringing you down. We'll do a A-U-Ma to enhance this feeling. From the bottom to the top. Closed eyes, inhale. Feel the vibration, feel your sensations. Take a couple of long deep breaths and come down. Okay, well, let me see one thing, how much time I have. 36. So I just have 9 more minutes. So I'll show you one technique for knee health, and then we'll go into pranayama, quick pranayamas. So if you can stand up and do, that will be ideal, like this. Okay, so let me show you stand up, then I'll show you sitting down. So standing up, you have going like this. You can go all the way down, so make it as stretched as possible. I mean, you can go down and touch it, and then you make your knees straight and put your 2 palms with those 4 fingers and little pressure, little pressure, little pressure. Hamstrings, back of the knee, calf muscles, just knees. You can bend a bit and then strengthen it. Bend, strengthen, bend, strengthen, bend, strengthen. And then you can do a chair if you want to do a chair after that. You can do that. And while sitting, you can do the same thing. Sitting wise, you put your feet out. Inhale. Go down as much as you can. And then do the same thing. All the way down. So inhale, put little pressure, exhale. Inhale, put a little pressure, exhale. Inhale, little put pressure, exhale. And then bend your knees, squeeze, 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 squeeze. And then come back. I think we're done with the asana and the Sukshma Vyayama portions. This takes like hour 15 minutes to really do it properly. Maybe I'll introduce in another class. And now I will do pranayama, short pranayamas, 2-3 rounds each. So 30 seconds of Kapalbhati. So spinal cord is straight, absolutely straight. Chin mudra. Or you can do a Brahma mudra. If you have some aches and pains here, hernia or anything, when we don't ask you to do Kapalbhati, but you can do a slow Kapalbhati. By putting a pressure here, you can control your hernia, and sometimes under supervision can do some Kapalbhati. Normally we don't tell you to do it in an open class. One-on-one we do sometimes as a therapist. So okay, exhale. I'll lead, you follow. When I say start, you start. When I say stop, you stop. Start. And relax. Okay, we'll do belly breathing. So maybe put your 2 palms on the belly. We'll do 3 rounds. Inhale. So just the belly comes out. And relax. Next is Anulam Vilam, Nasika Mudra, or you can do this Jala Mudra like this, pinky and thumb comes together. This is easier to do. I'm going to do this 3 rounds. Inhale, exhale, and do exhalation longer than inhalation. So right here, inhale, exhale, inhale right, exhale, left, right, exhale, left. Last one, inhale left, exhale right, inhale right, exhale left. Do Bhramari 3 rounds. You can do without putting your finger in the ears, or you can do Sammukhi Mudra, or you can just do, I like the putting the fingers, Baba Ramdev style. It does a little difference in your Pratyahara. You feel the vibrations much stronger. So let's do this. 3 rounds. Makara, inhale. Inhale. And relax. Just a minute of silence. Nothing else, just silence. Focus on your breath. Silence with breath. So observe your breath and silent. Okay, we'll do a closing prayer. Inhale and exhale. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschit Dukha Bhaga Bhavet. Om Shanti, Shanti, Shanti. Grab your right wrist from the left palm at the back. Inhale and exhale all the way. The ground, the front, for the peace, prosperity, and health for all. Thank you. If you have any questions, I'm going to be here for a couple more minutes. Exactly.
Thank you very much.
Thank you.
Thank you.
So try to attend the Vipassana on Friday, 6 p.m.
Thank you very much.
Thank you.
Thank you very much, sir. Could you get the recording of today's?
Yeah, I do record it, and then do you go through CHI's community WhatsApp group or something?
Yeah.
Okay,
What
so
time on Friday?
6 p.m. All meditations are 6 p.m. So mine is this Friday. Yeah, so yeah, I recorded it, so it should be there. Gaurav ji should be able to give it out. So I'll ask, because and then they'll be in the WhatsApp group, and maybe you can somehow get it from there. Or if you have my phone number, let me give my phone number. You can send it out.
Can you please give me your phone number?
Yeah, then you can send me a text, and I'll try to send that out. Hold on, just a second. 71431.
Madhuri Ben.
4. That's my phone number.
714
Yeah.
218 8784.
Yeah, and then I have an app called Dr. Yogi. You can see a lot of diseases, how they're handled, and I have a lot of YouTube channels and all that. So we'll surely get it out to you. Thank you. Thanks a lot. Thank you.
Tanmay how do we get into the WhatsApp group?
Somebody has. See, this is the thing. I do not have access to the whole database, so I don't know how to send it to everyone. But if you know somebody, why don't you do this? Send me a note onto my phone number, your email or whatever, and then if I get that from Gaurav ji, I'll send it out to you. I think that's the best way of doing it.
Email will send it. That's the easiest.
Yeah, and then I let me give you my email also, just in case. SMUKHOPADHYAY1@aol.com.
Oh, yours the techie tech, that's the one?
Techie Yogi, yeah. That's also there. The YouTube. I have a YouTube channel called The Techie Yogi.
I have that.
You have that? Okay, yeah, good. All of these will be loaded there also. So just
Okay, so your phone number, okay.
you keep an eye there. If you go there, you will see a playlist called Yoga and Chair Yoga. All my meditations are there. I have a COVID-19 protocol, that's also there. You can use all of that.
Saw that, yeah. I went there a few times and
Yeah,
I saw that.
Yeah, and subscribe. When you go to my YouTube channel, do a subscription. That helps me. That makes me a little more popular.
Oh, good. We will make you a lot popular because we really like you.
Okay. Thank you. Thanks a lot. Okay.
Okay.
Have a nice one.
What is the YouTube channel, please?
It's called. Okay. Let me put it there. But I'll give you. If you send me a text, I'll give you the exact URL. But let me write it down here right away. The Techie Talkie Yogi. It's hard to remember, but it's. Let me see my glasses. See, this is the problem I have. Techie Talkie. Okay. Write it down. Yeah, and we will. I'll give you the exact URL. Send me a note in my text me. I'll send out actual URL that we don't have to type all of this.
Okay.
Okay. Thank you, sir. Thanks a lot.
Send the email in the chat.
I did send it out. My phone number, my app name of my app, and my email, all of that. And when you do that, mention I'm this from the class. That way I know exactly who you are, and I'll send it out. Okay. Thank you, Ramanji. Thank you. Okay. Bye bye.
We'll definitely attend Vipassana meditation.
Sure.
I
Thank
like
you.
it.
Thank you.
I went a couple of times there. So.
Oh, fantastic. Then you can share your experiences.
Okay, thank you.
Okay. Thank you. Bye.